Good afternoon, everyone, and welcome to today's Council on Black Health webinar entitled, It's a Family Affair, Promoting Healthy Beverage Consumption Among Black Youth in Early Childhood. Today's presentation is the fifth and final webinar in the Spring 2020 webinar series offered by the Council Solutions to Diabetes in Black Americans course. This course is part of the NIH-funded Center for Diabetes Translation Research at the Washington University in St. Louis. The Solutions to Diabetes in Black Americans Core provides methodological and content expertise to advance the field of diabetes research in Black Americans. We really appreciate you joining us today. My name is Tiffany Eaton. I am a doctoral candidate and research assistant at the Dornsife School of Public Health at Drexel University, where the council is based, currently working with Dr. Shariki Kumanyika, the founding chair of the council. I will be your moderator today. The Council's mission is to develop and promote solutions that achieve healthy Black communities. We leverage the credibility and perspectives of Black American researchers, other collaborators, and research partners to facilitate relevant, community-engaged, actionable solutions that positively impact Black communities. Today's session will discuss sugar-sweetened beverage consumption among Black youth and will identify best practice recommendations for the promotion of healthy beverages to Black youth throughout childhood and adolescence. During the presentation, we ask that you post questions using the Q&A button in the Zoom webinar interface. We will review and select questions for our presenter to respond to after the presentation. If your question was not selected for response, we will share follow-up feedback after today's session. Please feel free to also use the chat window to interact with fellow attendees during the session this afternoon. Today's presentation will be recorded and archived for future viewing. We will publish the webinar online and share the link via email. Our esteemed speaker today is Dr. Carrie Cartwright. Dr. Cartwright is an assistant professor in the UGA Department of Foods and Nutrition, where her research is focused on early childhood obesity prevention. Her research agenda includes promoting wellness practices and policies in the early care and education setting. The overall goal of her work is to create healthy early care and education environments, or ECE, to prevent obesity in our youngest children ages 0 to 5. With an emphasis on decreasing health disparities affecting low-income and underserved populations. Dr. Cartwright has served as the principal investigator for 2 Robert Wood Johnson Foundation Healthy Eating Research grants centered on decreasing sugary beverage intake among young children and families. She previously worked as a research fellow at the CDC Division of Nutrition, Physical Activity, and Obesity. During this time, she promoted First Lady Michelle Obama's Let's Move Child Care Initiative. Dr. Cartwright earned a PhD and MS in Foods and Nutrition from the University of Georgia, is an esteemed graduate of Howard University, earning a BS in biology, and is a registered and licensed dietitian. Dr. Cartwright, I now invite you to proceed.
Thank you so much, Tiffany. Thank you everyone for joining us today and taking the time to be with us. I'm very excited to present this topic today. I want to specifically thank Shariki for the invitation to share this information. And thank you again, Tiffany, for handling all of the logistics. So I will get started. I wanted to ask a question to start out, and if you would just put it in your chat box, what you think the answer to this question is. What is the most common sugar-sweetened beverage consumed by young children? And when we talk about sugar-sweetened beverages, you'll see that I just have some examples here, little pictures of soda, coffee, fruit drinks, bubble tea, and different types of fruit drinks. Okay, if you guess that it is fruit juice drinks, this is correct. And this is not 100% fruit juice, but those types of sugar-sweetened beverages that are called fruit drinks. And so about 44% of young children consume one of these drinks per day based on recent data. So I wanted to give you a little bit of an overview of what we'll be talking about today. We're going to understand the effects of sugar-sweetened beverages on the health of Black youth, and then also identify policies and best practices to promote healthy beverages to Black youth. We will also talk about alternatives and resources because we want to give good information about tools that we can use to promote these messages, as well as credible resources. So I'll end with some discussion about some research projects that I have conducted in this area, and we will have questions at the end. So I wanted to start by having a true or false game to ask you questions about your knowledge of beverages related to young children. So this is the Council on Black Health edition. I'm going to put up some statements, and I just want you to review the statement and simply write down or jot down or keep it in your head to find out whether or not you think they are true or false. So I have 6 statements here, and I'm not going to read them all, but they're related to toddler milk, to skim or fat-free milk, health disparities in beverage intake, sugar-sweetened beverage intake, water, and drinking 100% juice. I'm going to just give you a few moments. Just read over these statements and mark down whether or not you think they are true or false. And we'll find out in the presentation what the correct answers are. Okay, so I'll move forward. So I'll begin by talking about the impact of sugar-sweetened beverages, or SSBs, as you may hear me refer to them as we go through the presentation on children's health. So we know that beverages are an essential contributor to children's health, and we know that children develop healthy habits early in life. So that if we can start children to have healthy beverages early on, this can contribute to better health outcomes later on in life. And so when we talk about sugar-sweetened beverages, just as a definition, we are talking about any liquids that are sweetened with various forms of sugar. And you'll see here that I have different forms such as sucrose or high fructose corn syrup. And then just some examples are sodas, sports drinks, fruit drinks, sweet tea, all those types of drinks that have added sugar. The issue with these drinking these sugar-sweetened beverages in excess for children is that it increases obesity risk for type 2 diabetes, and dental caries. And there are several research studies that have shown evidence of these effects on children's health. So if you looked at the true and false question, where it says sugar-sweetened beverage intake may decrease risk for obesity, type 2 diabetes, and dental caries, of course, that would be false. Now I want to go over some common beverages that children are marketed to children at an early age. And so you see here on the left of the slide these different types of beverages, and I'm just going to bring up the definitions for each one of these. You may or may not have heard of toddler milks. These are drinks that are made up of powdered milk or corn syrup, and they have different minerals and vitamins, and they're often called transition or weaning formulas. They seem similar to formula, but they are marketed as something that will help children to have more nutrients as they are coming off of formula. A lot of times they're also marketed in pediatrician offices, but what we found is that there is no significant data that supports that toddler milk is any better than cow's milk with a balanced diet. And so it is not encouraged that children drink toddler milk, and that's a message that we want to get out to people in the community. Also, beverages with low-calorie sweeteners are marketed to young children. And so we have diet drinks, light drinks, even those drinks that might be sweetened with stevia or monk fruit, aspartame, or other low-calorie sweeteners. When we talk about caffeinated beverages, those are the ones we're familiar with, things like soda, coffee, tea, and energy drinks. And then we have plant milks or non-dairy beverages. And so we have many different alternative milk beverages now. And so I just put a few examples here, such as rice milk, almond milk, coconut milk, pea milk. And with those varieties, there are specifically sweetened and unsweetened versions that consumers can choose from. Lastly, there are flavored milks that we're really familiar with, and they have added sugars, but no nutritional benefit over plain milk, and they can be flavored as chocolate, strawberry, or vanilla. Just wanted to acclimate you to all of those different types of beverages. So when we look at toddler milks are recommended as an alternative to cow's milk and a balanced diet, that would be false because they are not recommended. Now let's look at the benefits of healthier beverages on children's health. We know, starting with water, that water is essential for life. Plain water is the best thing for young children. It helps them to have improved cognitive function, and while their brains are developing rapidly at a young age, it helps to reduce weight gain because they aren't getting any calories from the water consumption, and it also helps to decrease dental caries. And we know that in many places we have fluoridated water that helps with our oral health. So, of course, water is essential for life, and it does improve brain function. So that would be true. When we look at the benefits of milk consumption on children's health overall, we know that it provides many nutrients that are very important for growth and development. So you can see here that we get different forms of protein, calcium, vitamins A, D, and B12, and we get these minerals that are listed here, such as potassium and niacin. It also helps children with their bone development, and we know that plain milk is the best type of milk to serve young children, and we'll talk about what type of milk to serve at what age in just a few moments. I also want to discuss the benefits of 100% juice consumption on children's health. And when we think about 100% juice, there's a wide debate about whether or not children should drink 100% juice. But we know that eating fruits that are canned, fresh, or frozen is best. It's ideal. The children will get additional fiber. However, there are vulnerable populations where they have limited access to fresh fruits or these different forms of fruits, and there's a concern for affordability of fruit. And so as we think about that, drinking 100% juice can actually contribute to adequate fruit intake because the child will be getting the nutrients from the 100% juice. So a combination of fruit and 100% juice is preferred to not meeting the fruit recommendations. And we will talk about the specific recommendations for the amount of juice that young children should consume in just a moment. And so as you look at our question about drinking 100% juice does not contribute to adequate fruit intake among children, it actually does. So that would be false. And when we look at sugar-sweetened beverage consumption for young children overall, we know that 2 to 5-year-olds are drinking sugar-sweetened beverages. So almost 50% are drinking sweet beverages each day. We know that prevalence increases throughout childhood. So from childhood to adolescence to adulthood, if young children are drinking these drinks, it is carried on throughout the lifespan. We know that this can be harmful because added sugars and saturated fat can lead to weight gain, as well as the other chronic diseases that I mentioned earlier. Last, I wanted to mention that health disparities do exist in beverage intake by race, ethnicity in the United States and by income groups. And these exist even in early childhood. And I'll get into that in a lot more detail in just a moment. So health disparities do exist in beverage intake by race, ethnicity, so that would be true. So what is being done? We have all of these recommendations that are coming out about beverages in early childhood, and the Robert Wood Johnson Foundation has been very active, and the Healthy Eating Research Program actually got together to work on a consensus statement for national guidance on beverages that should be consumed in early childhood. So Robert Wood Johnson convened an expert panel, and they had key organizations that you can see listed here: the Academy of Nutrition and Dietetics, they had dentists, they had pediatricians, and the American Heart Association. So these comprehensive recommendations were developed for young children and released in September 2019. So they are very recent. So I love this example, especially for researchers and practitioners that want to be able to look at a glance and see what are the specific recommendations for young children drinking beverages. And so as you can see, the ones at the very bottom are just not recommended. And we talked about those: flavored milk, toddler milk, and those other beverages that I mentioned earlier. And you can see with the plant milk, they're only recommended for children ages 12 months to 5 years if there's a medical indication or a dietary reason. But here we see specific recommendations for water by age, for milk by age, and we'll go over in just a moment, and even for juice. But this is a great way, and this is one of the key findings from the summary statement, and I'm going to tell you how you can access this for yourself as well. So what are the actual national beverage recommendations in early childhood? Starting with 100% juice, it's recommended that children under 12 months do not drink 100% juice, that they get their calories from whole fruit, from water, or from breast milk or formula. And then also we want to limit the 100% juice that our children aged 1 to 5 years are consuming. And so the recommendation is no more than 4 to 6 ounces per day. And so we want to think about the relative juice box that is about 8 ounces, and they should only be drinking 4 to 6. And so we could take that juice box and dilute it and have half and half, but limiting the juice that the children are having, but still allowing them to have some amount if it is needed. Also, when we look at milk, Serving whole milk to children ages 12 to 24 months is appropriate because it has additional fat for brain development. But by the time those young children turn 2 to 5, they should be drinking skim or fat-free milk, reducing the fat, but they'll still get the vitamin D and the calcium that they need for the milk from the milk. When we look at water, there are specific recommendations from 1.5 to 5 cups of fluorinated plain water based on specific ages for your children. And so that's why I showed you that table where you can go back and look at the specific cup recommendations for those ages. And lastly, as we've talked about previously, eliminating flavored milk, toddler milk, sugar-sweetened beverages, those beverages with low-calorie sweeteners, and caffeinated beverages. So here, our last true or false question: skim or fat-free milk should be served to young children aged 12 to 24 months would be false because they should have whole milk. So I want to bring to your attention with Rockwood Johnson, not only did they do the consensus statement, they also have a website called healthydrinkshealthykids.org. I'm not going to play this video for you right now, but I wanted you to see what it looked like, and it's accessible on their website. And I'm going to show you how you access their website, but it's just like what I told you with the what I just showed you with the recommendations. And so these 5 pro tips are here, and they make it very simple. If you're working with people in the community, if you're working out in the field and you want to know how to promote these messages in a simple way, this is a great way to do it. And so I wanted to make sure I showed you that. And so I think one of the things that I told you earlier, that disparities existed, and I want to get into that as I talk about approaches for promoting healthy beverages for Black youth and why that is important. As you can see here from this data from the National Health and Nutrition Examination Survey, this is for children aged 2 to 19 within the U.S. And so you can see here for the different colors, we have a range of races from non-Hispanic, Asian, Hispanic, non-Hispanic white, and non-Hispanic Black. And you can see here that for water consumption, non-Hispanic Asians are drinking the most, whereas Black children are drinking the least amount of water. However, conversely, the Asian children are drinking less sugar-sweetened beverages, and Black children are drinking more sugar-sweetened beverages, at 30%, with the highest rate. And so we must do some things to address this. And so as we're looking at this, I want to, as we're discussing this, I want to also just bring forward what are Black children really consuming and what are the differences. And so we see that from children ages 2 to 19, and this is specific data from a recent journal article from Demmer et al. That really shows the disparity from ages 0 to 5. And so I've highlighted here the consumption of sugar-sweetened beverages, and you can see that the mean for children across the board it is higher for every age group among Black children, and even markedly different specifically for children ages 4 to 5. And we want to be able to address this as well. So what are some of the factors that influence sugar-sweetened beverage consumption among Black youth? Well, we know that there are many personal, behavioral, and environmental factors. But one of the major influences that really focuses on environment is targeted marketing. We know that drinks are disproportionately marketed to Black youth, and Black youth are also highlighted as major trendsetters in terms of culture, and therefore large beverage companies highlight Black youth and target Black youth to promote their products. So actually the percentage is 50%. 50% Black youth are exposed to 50% more ads than white youth of the same age. And so again, if you're wondering why, which is one of the things that I wondered when I looked at the data, it begat the question, well, why are our children drinking, this disproportionate amount of sugary beverages? So this is just one of the reasons that can contribute to that. So when we think about targeted marketing toward Black youth, we know that it influences children's eating and drinking habits. We know that there's disproportionate exposure, and we know that this can come in many different formats. It can come from TV commercials, magazine ads, social media, so many ways that young children can be marketed unhealthy beverages. This is a recent article in Pediatric Obesity that shows the changes in food and beverage advertising for Black youth and white youth between the years of 2008 and 2012. So I've highlighted here especially the rates of change for preschoolers, this 2 to 5 age group. And you can see here that the percent increase for young Black children is 16%. And that is just very marked. And so you can see that there is a higher amount of ads that are viewed per day, ads that are viewed per hour, and then the daily viewing time increased over that time period as well. And so even thinking about that, another one of the things that I thought about with COVID, with more of our children being home, we really have to think about how we can advocate and promote healthier beverages if these children are being bombarded with messages that could be promoting unhealthy behavior. So I want to set up this video that I'm going to show you, and it's about a 5-minute video, and I put it in here purposely because it really shows how we can interact with parents and families in the community and to promote messages about healthy beverages. It was done by researchers at Wake Forest Baptist, and they are the health center, and they are working on this in an avid manner. So I want to share this video, and hopefully we'll have some discussion about it. So I'll play it for you right now.
When you drink one of your fruit punches a day for a year, that's like drinking or eating a whole bathtub full of sugar. I'm gonna stop.
So my name is Brisky, and I am a registered dietitian. Striving for zero sweetened beverages is very personal to me because about 1.5 years ago, my father died of a heart attack. It was complicated by obesity and diabetes. Growing up, we drank a lot of juice and sugar-sweetened beverages. Sunny Delight was our favorite. And I was bullied for being overweight. I have a daughter now, and I don't want her to have to go through what I went through. Another 10 pounds. So that's 50 pounds of sugar in a year just for orange juice and Gatorade. Let's all make sure we understand what we are talking about. The sugar-sweetened beverages are any drinks that have sugar added to them. Fruit punch, sports drinks, sweet tea. And then 100% fruit juice is pure fruit juice with no added extra sugar. So this is a 20-ounce Gatorade. That is like eating 3 Fun Dips. So they think they're drinking something that's helping them quenching their thirst. They're really just pouring a lot of sugar into their mouth.
This is just like drinking a soda that I don't let you drink.
That's crazy. Right now, I'm really excited to be working with 3 families, the Moores, the Sanchez's, and the Sprouses, on a 1-week challenge to inspire parents and kids to get in the zero zone. You're gonna be in a 1-week challenge where there's no sugary beverages. That will be tallied on this board. Your whole family is gonna do this. It is a competition. Ooh, you like competition.
I can't believe that drinking this is like eating, you said 7 of these?
So for kids younger than 7, they only get 4 ounces of juice a day. For kids that are 7 or older, your age, they get 8 ounces of 100% fruit juice a day. If you want more, we can dilute it with water. You have your 4 ounces of juice, but then you pour another 4 ounces of water. That looks a little bit more reasonable to them, you think? Are you ready for the challenge?
Yes. We are going to eliminate some of the sugar in our diet so that we can be strong and healthy and be here for each other throughout life as long as we can. Are you ready? Are you ready to do the challenge?
And I see a Sprite in here that we have to get rid of. Let's see, here's another Sprite. We can't make sure that our children stay away from sugar in everything because sugar is in everything. But if we can control what they drink, that will help decrease their risk of so many horrible health effects later on in life.
Well, my family has a history of heart disease on my mom's side. Seeing how much sugar is in all those drinks today kind of makes you think about wanting to buy in and give them to your kids too.
Andrew, why are you sad?
Because you dumped out the Sprite.
It's hard to drink water.
All the time.
Yeah, all the time. It gets boring.
Now, I wouldn't leave you without demonstrating how we can make water more exciting. So I have water bottles. You are also getting a fruit infuser. And you're going to put your favorite fruit in there. Mine is strawberry, so we're going to start there. You're going to put it in your water. What will happen is the natural flavor and juices of the fruit will come through and your water will start to take on that natural flavor.
And that doesn't cost any points or anything?
Being a part of somebody's journey where they stop drinking sodas because they've gone from getting that sweet tea at Bojangles every day to switching it to unsweet tea or drinking water are why I do what I do.
If you really buckle down and focus, it's not as hard. And then once you get past, the first few days, you really start thinking about it, and it's actually easier to say no to those sugary drinks. It's
right.
Easier to do the water.
Water is your best friend, definitely. I'm sticking to it.
I understand it was just not to completely change your behaviors, but it was just to make a little change, a positive change.
More ways to be healthy.
Okay, so one of the things that I did want to share with you are resources to promote healthy beverages to young children. And so with the Robert Wood Johnson Healthy Drinks, Healthy Kids website, there are infographics that are ready to go, web graphics, social media graphics, beverage one-pagers, and wonderful videos, as I've already explained. As we look at this, I wanted to show you exactly what is available. So if you're doing research in this work and you want to get these messages out, this is an example of the types of graphics that you can use, very succinct, very colorful, nice graphics and information with the website so that you can promote these on different formats for yourself as a practitioner. There are also key one-pagers. And so this is a one-pager that has an example for sugar-sweetened beverages. And it tells exactly what sugar-sweetened beverages are, as well as figuring out why we are recommending that young children don't drink these beverages. And so that's very important because what I find in the field is that parents are very interested in the information, but they want to know the why. So these are turnkey, evidence-based documents that will allow you to explain these further and to learn on your own if you're if you need more information about why these recommendations are in place for young children. So the website here is called healthydrinkshealthykids.org, and I wanted you to be able to look at this and see it because it includes the full report, the consensus statement, the videos, the infographics, and all of those resources. So you'll have this and just write this down so that you can go back to this website. An additional resource is if you're working in the early care and education setting, which is very important because many, of course, parents are working, and we know that we have millions of children, 11 million children in the United States that are in some form of out-of-home care. And so while I was at the CDC, we worked on a toolkit called Increasing Access to Drinking Water and Other Healthy Beverages in Early Care and Education Settings. And this is a toolkit for early care and education providers where you can allow them to understand why we are having these types of recommendations, as well as having action plans and resources to overcome barriers within the early care and education setting. So I wanted to make sure that I shared that resource as well. In addition to promoting healthy beverages or saying that we should not drink sugar-sweetened beverages, I think it's very important that we promote healthy beverages and give alternatives to young children and families. So things like fizzy water, sparkling waters are things that we can promote. They don't have calories, but they do have some flavor. We can think of creative ways to make them even more flavorful. And so we already talked about adding water to 100% fruit juice or adding fruit and herbs to water. This specific example that you see of this lovely picture here is from CalFresh, from the California Department of Public Health. And I put the URL here because they have a website called California Champions for Change. And I love this example of real fruit punch, where you use a little bit of fruit juice concentrate, some club soda, pineapple chunks, and then some frozen fruit with ice cubes, and you mix it all up and you have this refreshing, what they call real fruit punch. And so giving people, when you give these messages, giving them real alternatives that children will actually like and consume is very important. And so those resources are available on this website along with many other recipes. Another resource is using characters. It's really important to get kids engaged in the conversation about drinking water and why it's good for them. And this is a tool that is great for both parents and children and researchers. And so when you look at this, this is a character called Potter the Otter, and Potter loves to drink water. And so as Potter is drinking water, he is learning along his journey and telling Goose he shouldn't drink juice, and Skunk he shouldn't drink punch. And along the way, all of his friends become healthy. And there's an entire series that was created by First Five Sarah Clara County. And so I have that URL as well. You can Google it. And there are even interactive, there's an interactive book reading, because it is a book series as well, of Potter actually reading his book and slurping his water through a straw. And so that's another wonderful resource to get children engaged in drinking more water. I want to also give you some examples of research. And so with that, I wanted to explain some of the work that I've been doing here in Georgia. And I wanted to tell you first about a study that I've done called the Georgia Child Care Wellness Study. And it was a mixed method study that used both quantitative and qualitative approaches with early care and education providers. And those are our teachers that work with children ages 0 to 5. And we work with programs that had early care and education centers, family child care homes that generally serve up to 6 children, and even our license exempt programs. And within the state of Georgia, we have a database of our license exempt programs. And those are programs that operate legally without a license, such as our faith-based or Mom's Day Out program. We also have a study that we are working on currently to promote healthy beverages among Black families. And I've given you the evidence why it's so important to promote healthy beverages to Black families, and especially because Blacks, overall, Black Americans are at higher risk for obesity, diabetes, heart disease, and a lot of other chronic diseases. And so both of these studies were supported by the Robert Wood Johnson Healthy Eating Research Program. And I wanted to share a little bit about both of these studies. So we know the early care and education setting is critical for obesity prevention. As I mentioned before, about 75% of youth in the U.S. participate in early care and education programs. And in Georgia, we have about 330,000 children that are enrolled. And of course, these are pre-COVID numbers. Our child care setting has been greatly affected by everything that has been impacted by everything that has come with COVID. But within this setting, children receive up to 2/3 or more of their meals within the early care and education setting. Within the state of Georgia, we do have licensing provisions that are related to beverages. Our children are receiving healthy food in many of our programs through a program called the Child and Adult Care Food Program, which reimburses our child care providers for serving healthy meals. And so here, all of our program types are eligible for what we call CACFP, but our child care centers are required to follow their recommendations, whether or not they participate in the program or not. And so in 2016, the Child and Adult Care Food Program was revised to have healthier requirements for the first time since 1968. We also have a quality rated program here in Georgia where our child care programs are rated on a star rating. And within those star ratings, we do have a nutrition and physical activity domain that includes beverages. And so that's important in terms of putting this into context for what we did. So when we did our survey, we surveyed, we had our survey to go out statewide to about 3,000, a little over 3,000 providers, and we received back about 1,000 surveys from across the state. And so what we found was that with our survey respondents, the majority of the children enrolled were either Black or white. Most participants participated in the Child and Adult Care Food Program. We had a good range of our family child care home and our centers participating. And we had a good percentage of our license exempt programs. And this is very important because there are many different programs that reach a lot of our children of color, and they're not represented in the research. So we were very pleased to get this percentage response from our license exempt programs. Most of our programs serve families with an income of $35,000 or below, and this was all self-report. And most of our participants completed the survey online. When we asked them about whether or not they were able to implement the new child and adult care food program provisions, a lot of them did say that they followed the guidelines, about 75%, but we did have some percentage that said they had not heard of the new pattern. And so I asked the question, are ECE programs in Georgia serving sugar-sweetened beverages to young children? And so if you're like me, you might have thought that the answer was yes, but it's actually no. The majority are not. And so 96% of our participants reported that they were not serving sugar-sweetened beverages. So what we did was we looked at our data for beverage policy implementation, and we asked them about what types of milk they were serving, what types of juice, what types of water, and if they were serving sugar-sweetened beverages, just as we did, as we reviewed in our recommendations. And so we saw that pretty overall, the programs that were participating in the child and adult food program were doing better in terms of serving the correct type of milk, that they were serving less juice, that they were not serving the sugar-sweetened beverages. But what we saw overall was that we needed to do better in water. And so we didn't know that that was something that we would find, but our non-CACF programs, CACFP programs were doing a little bit better in that area. When we look at beverage policy implementation by program type, which is our family child care homes, our centers, and our licensed exempt, our centers did fare better in a lot of areas. They did a little bit better in sugar-sweetened beverages, but there were not major differences between our centers and our homes when it came to fat-free milk. We did have differences where our family child care homes were doing better with whole milk. And you see here that our licensed exempt programs are going to need some additional help. And then when we look at juice, our licensed exempt centers were actually doing better, not really significantly different between our centers and our homes. And there were some programs that were serving juice to young children as well, to our infants. And then again, when we look at our water, you can see here overall, even though our centers were faring better, that we need to do better about having water available both indoor and outdoor for our children. So we asked the question as well on the survey, have you ever had any beverage policy training to our early care and education teachers? And we found that 85% had not had beverage policy training. So with that, we decided to develop an interactive online training about beverage policy for early care and education providers. We partnered with the Georgia Department of Early Care and Learning and gained guidance in terms of the type of formatting and the type of content that they would like to have in our training that we call iBev Smart. And so what we did was we developed 4 training modules based on the different categories of beverages. So sugar-sweetened beverages, milk, juice, and water. And so we used a program development tool called Articulate 360 that helps us to create e-learning programs. We gave our ECE teachers an introduction and background information, just as I've done for you here today. And then we also were able to quiz their knowledge by giving them interactive games, quizzes, and videos to cover the information that we taught. This is just one example of one of the interactive activities. And so if you look at this refrigerator, it would be closed on the screen at first. And then it asks for the participant to remove all of the SSBs. So if you look at this, you would literally take the mouse and move the soda to the table, and you could move the chocolate milk to the table. You would take all of the sport drinks and everything that is sugar-sweetened beverage and move it to the table, and then get a response as you are going through the training. And so this has been very popular among our child care providers, and we're working to promote it on a large scale. So I wanted to bring back this graph because the next study that I wanted to talk about is focusing on Black families. So we see here again this visual of how disproportionate water consumption and sugar-sweetened beverage consumption is among Black youth. And so our study that looked at promoting healthy beverages among Black families just really looked at the data. And so we know that there's increased sugar-sweetened beverage consumption of at least 1 time per day among Black adults aged 20 to 39. And so when we looked at that, 77% of Blacks versus 50% of whites are drinking these sugar-sweetened beverages. And this is important because these are our adults of parenting age. And we know that parents directly influence what our children are doing. And so we want to influence the entire family when we are working on this topic. So what we did was we looked at this in two phases. And the first thing that we wanted to do was to do focus groups to understand the perceptions and barriers to limiting sugar-sweetened beverages among Black parents of young children. And we wanted to do this because there's just not a lot of data or research that really looks at what are Black parents' perceptions and what is their understanding of serving these beverages to their children. We also are in the process now of developing and testing messages to develop a message campaign to promote healthy beverages to Black parents of young children and Black families. So in our phase 1 results, we found that more than 50% of our focus group participants said that they and their young children consume more than one sugar-sweetened beverage per day. When we asked them about things that were negatively associated with sugar-sweetened beverage consumption, they noted weight gain, dental caries, diabetes, and even food dyes. And one person even just talked about how she was not informed about how these drinks could affect her children's teeth. The majority of participants did not have negative associations with water overall, except when it came to excess urination. And then there was no report of water mistrust. And a lot of times in our underserved communities, these were parents that we were working with. These are low-income parents that had children enrolled in Head Start, and none of them mentioned water mistrust. So I thought that was an interesting finding. We also looked at the common factors influencing beverage intake decisions. And so we asked them, what types of things influence what you serve in your house when it comes to beverages? So parents mentioned things like price and budget, the convenience of being able to just grab these beverages anytime they wanted to, the type of food that was eaten. And an example of that would just be if they had fried food, that they might want to have something fizzy in it, like soda to drink with it, having health concerns. They might not consume a sugar-sweetened beverage if they knew they had diabetes or they had a negative health effect that they knew about. And then, of course, taste and preferences. So this is just a quote from one parent that said that her daughter mainly asked for lemonade or fruit punch. And so they had to be from specific restaurants. She would only drink them from certain places, but other than that, she would drink water. So it really asked the question then, how often is this family eating out? And oftentimes we know that a bottle of water might be more than a sugar-sweetened beverage, especially when you think about the things that are accessible in the neighborhood, such as things like Little Hugs, which are drinks that are just about $8 for $1, 8 ounces, and made with high fructose corn syrup, water, and food dye. Also, we asked about common barriers for limiting sugar-sweetened beverage consumption among Black children. And so parents mentioned fast food, the fact that the default beverage at many fast food places might be a sugar-sweetened beverage, price, knowing that they can get sugar-sweetened beverages, a 2-liter for 99 cents, and it's something that they want to have in the house so the children will have something to drink. Again, availability, just having it around and available everywhere. Behavior. Parents mentioned that children having tantrums, they would try to use the sugar-sweetened beverages to calm the children to avoid having tantrums or other behavior problems. And then peer influence. And so one parent just mentioned that when her children see another child with a drink in the neighborhood or at school, then they want to have that type of drink. Or even when they see them, if they see the parents themselves having a drink that is sugary, then they want that as well. So when we asked the parents about resources that they wanted to have in terms of the recommendations of what they would have in order to be successful, they said they wanted healthier alternatives. And that's one thing that's very important. And that's why I really have thought about the different types of resources and developing recipes even within our research lab, where we can come up with alternatives that would be tasty to young children and specifically to Black families. They mentioned that they wanted flavored water. They wanted to know how to flavor their water, how to make it appealing to their children. They wanted a support system. And this was a very interesting finding because they said, the parents said within the household, they may want to do something that's supportive, but outside influencers, even grandparents, cousins, their other family networks or friends might not be supportive of the change. And so they needed a support system in order to make the change successfully. In addition, they talked about having celebrities or characters to promote water. We know conversely that a lot of times celebrities and characters promote sugar-sweetened beverages. So they talked about using this method to promote water and to make it exciting for young children. In addition, they wanted guidance about talking to children about water, and that's why I gave an example of part of the order. How do you get them to understand how important water is and establish that at an early age? Because some of the parents reported that the children just simply don't like the taste of water. So how do you get them to understand how important it is? They also wanted to know specifically what are the benefits that I will gain from drinking less sugar-sweetened beverages. And so as we talk about that, of course, this website that I talked to you about, Healthy Drinks, Healthy Kids, has an entire resource section for parents, which is really important. And I think when parents get together and they're able to get this information, that we can move the needle forward and push towards success. And I've even seen within our focus group a parent that would come on and say, we drink Kool-Aid, we drink soda, I drink soda, I'm addicted to it, it's not going to change. And then just from hearing from other parents and what they're doing, change within a 90-minute focus group in order to go toward a better change. And so I think that's just very, very important. And it was very a significant finding that we found. Also, the parents wanted synergistic messages promoted at the childcare centers. And so when we talk about the importance of working with childcare providers, that is a big part of any family's life that has young children. And so how do we promote these healthy beverage messages so they are seamless, coming from the home within the childcare setting, and making it a support system where it's just all surrounded and it becomes the default or the norm for the children. And so with that, I wanted to thank all of the folks at Robert Wood Johnson that have helped to support this research. I wanted to thank the Georgia Department of Early Care and Learning, all of the ECE professionals that have assisted us, also my Childhood Obesity Prevention Lab at the University of Georgia, my former research assistant, Natalie Celestin, and my graduate students and researchers that you see listed here.
And I want to show you my references here. So this will be available when we play this back later on. And I just want to thank you so much for your time. Again, I'm very passionate about promoting healthy beverages, especially to young children, especially in Black communities. It's low-hanging fruit. Often when I go into the communities, it's a change that people are willing to make. So I hope I have inspired you to be a beverage crusader and to promote healthy beverages to young to Black families and to families in general. Thank you again for your time, and I'm going to turn it back over to Tiffany. Thank you so much.
Thank you. We would now like to invite our participants to post questions using the Q&A button in the Zoom webinar interface. We already have a few that were coming in as you were presenting, so I'm just going to start with the earliest one. One attendee mentions that they've heard it's common for parents to dilute juice with water, and we've seen it even in the video, and you mentioned it in your presentation. But maybe if you speak a little bit as to why some parents do this.
Repeat that one more time, as to why some parents do what with the water, Tiffany?
Dilute the juice with water.
Oh, why do some parents do that? Okay, so one of the things is, so if you dilute the juice with water, then you won't be getting the full dose. And so if you're trying to work toward only having 4 to 6 ounces per day, you could take 4 ounces of juice and add 4 ounces of water, and then that child would have 8 ounces. And so that's the practice that I have even within my own home. And so they've only gotten the 4 ounces, or I might do 2 ounces of juice with 2 ounces of water. It becomes the child's preference for sweet, that sweet taste becomes less, because they get used to having drinks that don't taste as sweet, and then they still feel like they're getting hydrated. They get a nice amount of drink, but it's not over the recommended amount of juice.
Got it. So it's more a way of just moderating the amount of sugar they're intaking.
Yes. Yes.
Awesome. And so we do have another question. An attendee asks, was there any discussion by parents about the family dynamics influencing sugar-sweetened beverage consumption? This attendee wonders how cultural norms of families shape SSB consumption within your group of parents.
Absolutely. And so we have just found some really interesting data. I'm very excited about this project. And so one of the things that happens is that, of course, some people don't want to change. And so as again, like I told you, that kind of anecdotal example of one parent hearing from other parents and just saying, let's just try. And one of the reasons I really love that video, and I'd like to thank Dr. Christina Henderson for allowing me to share that with you from Wake Forest, is that even if you try just for a small amount of time, I actually had a focus group where there was one parent who was doing a water week challenge for herself. There was one parent that was adamant that she would only serve Kool-Aid, and there was one parent that would only serve water. And there was a spectrum of parents, but just having all of those different types of people was very interesting. And so what they were saying is, I don't know how this is going to go over in my house. We drink these things, and I don't think that it's going to help, just kind of telling them. And so we started to talk about alternatives, which are so important. And we actually asked the question, what would help you to stop drinking these beverages? What things do you need? And one of my parents just said, you'd have to stop making the soda because I'm addicted. But by the end of the focus group, she was very willing to at least explore it. And so I think what we have to do is really have broad discussions and have solutions to barriers. And if we can just get them to start, it could be a 1-day challenge, it could be a 2-day challenge, a 3-day challenge, whatever we can do to push the needle to show them that it can be done. And it doesn't have to be an all or nothing, but at least to make a change, because what I'm finding is that many of my parents are not ready to just shift all the way over to saying no sugar sweetened beverages, but they're willing to at least make small changes.
And awesome. We have another question sort of related to the parents, and that's whether the relationship with the dental caries can be influential with parents, or do they feel like the fluoride takes care of that?
No, actually, the dental caries were very influential. And so that's something that came up a lot in terms of our discussion on what were the negative effects. And so we had a lot of parents saying, I just didn't know. I had no idea that these sugary beverages stay on their teeth, or it could rot their teeth. And that was something that came out a lot of times, rotting their teeth. And so that was really a major influence to turn them away from drinking the sugar sweetened beverages.
And so in thinking about turning away from sugar-sweetened beverages, another follow-up question about parents. Did parents bring up issues about drinking tap water?
Actually, what we found, we didn't find water mistrust, which was interesting, but we did find that they said that their children oftentimes did not like the taste of water. And so some of them said they did drink bottled water. And so they were just more concerned about, we did not get like specific, we don't drink tap water, but it was more of a concern of how do we get this to taste good? If a child just says, I don't like water in general, but we did not get opposition to drinking tap water in our study.
Okay. And then thinking about to some of the diseases you related to versus calories and weight gain, how important was disease as a consequence versus weight gain or calories, and thinking of sugar-sweetened beverage consumption?
It really varied. Some of the parents really did think about just overall health. I think when we kind of got through or had breakthrough with parents, they said, I just want my child to be healthy. I do want to further explore, especially within the Black community, how the thought of weight gain, the message of weight gain, and that's the part that we're working on now, is that something that is highly influential. And so we're working on that now with our messages just to see how much it comes up. But it was mentioned in terms of our findings, what were the things that were negatively associated. Parents did cite weight gain as something that would be negative.
Got it. We also have another question. This attendee asks about the issues with plant milk. Research suggests that approximately 75% of African Americans are lactose intolerant, and they're not sure whether we really know enough about the metabolic, immune, and general health effects of consuming milk while lactose intolerant. Would plant milk be recommended in the case of kids being lactose intolerant, the low sugar plant milk option in particular?
Yes, and so you might remember on that key findings type of chart that I showed, there was a part for the plant milks and non-dairy beverages that says if you needed it for a dietary reason or for it was medically recommended by a physician, that would be fine. And so in terms of it's not something that would just be promoted in general, but it is an acceptable alternative. And one of the things that you'll find on the Healthy Drinks, Healthy Kids website is an entire one-pager about that. And so it can be an acceptable alternative. So thanks for asking that question.
And I see we have two more questions, so I know we're pushing on 2 o'clock, but if I can just ask these two before we go. One attendee asked if any of the parents mentioned that they never went to the dentist and thinking of price.
Did they mention that they had not been to the dentist? Actually, no, because I was working with parents that had children enrolled in Head Start. And so many times they get benefits. There are, not specifically for these parents, but I know even with a lot of my Head Start centers, there'll be mobile dental units. And so the children are required to have a dental visit. And so they get those. Now, what they were finding was that they were having dental caries, but they didn't have an issue with not having access to a dentist because they were Head Start parents.
Okay, got it.
Mm-hmm.
And then another attendee asked, what about items such as sweet tea made with fake sugar or diet drinks?
Right, and so that's another area where we recommend that we do not serve those to young children. And so all of those beverages with low-calorie sweeteners, as we kind of talked about, are actually not recommended. And so again, on the Healthy Drinks, Healthy Kids website, there's a wonderful one-pager that explains that the data shows that there's not a lot of benefit for that for young children, and we don't know the long-term effects. And so the overall recommendation is that we don't serve those types of beverages to young children. And when I say young, I'm still referring to children ages 0 to 5.
Okay, great. I just want to thank you, Dr. Cartwright, for this insightful and interactive presentation on the promotion of healthy beverages among Black youth, as well as resources and national recommendations for healthy beverage consumption. And on behalf of the Council on Black Health and the Solutions to Diabetes in Black Americans Core, I would also like to thank our attendees for participating in today's webinar. We will share an evaluation survey and video of this webinar shortly. Have a pleasant afternoon, everyone, and enjoy the rest of your summer.
Thank you.